I am Sara Vandall. I am a registered nurse and I'm studying to be oncology certified in this profession. I have been a nurse for 3 years as of August, and I have been at the Cancer Center for 1.5 years now. The curiosity started with my grandfather. I was a senior in high school and he had been diagnosed with cancer. My parents would drop me off with him to be and visit with him at Memorial. I got him the occasional glass of water, the blanket, but he would only truly light up when his nurse would come in the room. And I said, I want to do that for patients. How I like to explain to patients is my job is to make sure you are fit for chemotherapy. How is your lab work? How are your symptoms? How's your symptom management? Is there something that we have overlooked? Is there a need for another scan? Is this treatment doing what it needs to be done? That is my role here, day in and day out. I'm administering chemo. I would say 25% of the time I'm also administering iron. Hematologist, oncologist, so a lot of iron deficiencies, anemia. We do a lot of injections. There's a lot of hormone therapy. It's teaching. I'm not just their nurse, I'm their advocate. You know, is this anti-nausea medicine truly working for them? Are they able to get here safely? How are their finances? It took extensive training. There's first a lot of observing. It's just a completely different type of nursing. One of my coworkers actually said this week, it's like we're getting 8 new admissions every day because we're doing a full head-to-toe assessment. Everyone is getting a different drug. Everyone's getting a different diagnosis. So there's a lot of balance. I'm assessing their symptoms, like a review of symptoms is what we called. So it took learning the assessment, what I need to be looking for, fever, shakes or trills, any uncontrolled nausea, vomiting, diarrhea. I'm pinpointing even little things such as ringing in the ear, stuff that's pertinent to single chemotherapies. So you are learning hundreds of different drugs, hundreds of different diagnoses. So it was about a 6 to 10 week orientation, if I'm not mistaken. And I had a preceptor, and she is still my preceptor as of today. And you're always learning. I'm asking questions constantly. In official terms, I am studying to take an exam in the month of December to be oncology certified. I have permission to talk about this, she said. I have a 29-year-old who beat breast cancer. She just fresh newlywed. And I saw her every week for up to like 36 weeks, seeing how her attitude is now from then the first day. We're able to remember those moments. The patients rely on us to be their bright light, to be their sunshine in such a dark time. They rely on us to be hopeful. They rely on us to be honest to an extent. What is going to happen to me? Am I going to lose my hair? Am I going to wake up with mouth sores tomorrow? And it's my job, because I don't know, every patient is different with chemotherapy, but what our job is to tell them the reality and aid them with all the resources they need to get through this. Unfortunately, we do see people whose battles end, and our hearts are ours are different in a broken way, not just as broken as the families, but we know them in a different way that the family does. We know their symptoms, we knew what they struggled with. And you connect with people on that level, especially in the life as a nurse. And like the team here is fabulous, but we really have to rely on each other. It does get very hard. Your math course is as high of a math as you can go. Definitely anatomy, physiology, and chemistry. Those 3 classes especially